There's a latitude gradient for these, and there's a reason for that, and that's because the sun very naturally kind of subdues the immune system and increases something called regulatory cells. So there's B and T regulatory cells that are like the natural calming off switch. It's really quite lovely.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've been doing pretty well, but just looking at all this sunshine we got outside, and I mean, you're in Florida, it's sunshine galore there too. Like, have we ever seen a drop of snow? But aside from that, I was just thinking how good the sun can be for us, or just thinking about UV therapies.
Oh my gosh, yeah, you hit it right on the nail, my friend. You are in California, I'm in sunny Florida, and in between us, there's a lot of sun to go around. So all of us in the skin industry and the skin business, we are well aware of that big planet shining its rays on our skin, causing some damage, but also can be beneficial. And it's always like this tight balance. And whenever I think about that tight balance, there's one name that comes to my mind. Since her spectacular presentation in one of our integrative dermatology symposium, I've been a huge fan of our mystery guest. Shall we introduce her?
Absolutely. And you said shining away. Well, she's the founder of Shine Functional Dermatology, which is a dermatology clinic out in Lincoln, California. And I'd like to introduce Dr. Katie Varman. She's a board certified dermatologist, truly an integrative dermatologist. And today we're going to be talking phototherapy, photoprotection. And I couldn't think of anyone better than you, Katie, to come join us. So thanks for joining us here.
Thank you so much for having me. It's fun to be back.
Hey, Katie, I thought maybe we can start in the beginning because it is not uncommon to talk about sun protection and light therapy and all kinds of things that relate to sun and dermatology, but you took a special angle on it. How did that become such a fascination for you?
Gosh, I'm trying to think of, I grew up in California. I've always really loved the sun. And so when I went to dermatology residency and found out that I'm not supposed to be in the sun and I'm supposed to be waking up and putting sunscreen on, it didn't quite fit well with my lifestyle. And so the more I learned, the more I found out that there's a ton of benefits to appropriate moderate sun exposure. And then with all of these beautiful phytochemicals and nutrients in our diet, we really have perfect defenses to be able to tolerate that sun exposure so we can get, all of the benefits without unnecessary risk of skin cancers and photoaging. So I kind of walked into it slowly and I just fell in love with the science, I guess.
It is fascinating. And what I really like about you, Katie, is that you're not afraid to go against the convention. I think a lot of dermatologists just say, just put sun protection, sun protection, sun protection. And this can be something that has consequences. I see a lot of vitamin D deficiency, for example, in sunny Florida. But you hit it perfectly when you said there's moderate and there's a way to do things right so we don't do too much of it. So maybe at this point,
Hadar, can I jump in and make a comment here, guys? Because the truth is, first of all, we always talk about moderation for a lot of different things, but to entirely cut the sun out, doesn't make sense
Right.
to me as a dermatologist either. I think we have to be prudent about this. And I think it's always been kind of hidden in some of these messages that it should be prudent sun exposure, but prudent sun exposure doesn't mean you live underground,
Right.
So
Exactly.
I feel like going against the convention is not only plausible, I feel like it's sensible.
Yeah. And it's really harmful to be completely hidden from the sun, living this kind of vampiric lifestyle, especially if you have, darker skin colors. So there was a study out of Texas, a few years ago that said sunlight's not really an important risk factor for the development of melanoma in people with skin types like 4 through 6. So people with skin of color. And I think that's something that is really important because vitamin D deficiency, insufficiency is a very huge risk in that population because of the associations with blood pressure problems and cardiovascular disease and even diabetes and all these things associated with low vitamin D. So just because you can't see, the effects of inadequate, insufficient sun exposure, as well as you can see a skin cancer, the consequence of too much sun exposure, doesn't mean it's not there. And it is a real risk. And there are really, really amazing articles out there that talk about the risk associated with inadequate exposure. So I think it's something that as a field and, as dermatologists, we need to kind of recognize that there's more to a human than just their skin and really
That's so true.
right. And like really personalize it for people. It's not just one size fits all.
Just to round up this part of the discussion, because I don't want to dwell on it too much, but let me play the devil's advocate here for a second, because it is a subtle message, right? We don't want to say completely, ignore the sun. We don't want to say completely hide under a rock. How do you communicate this subtlety to your patients?
I mean, I don't really have any trouble. I mean, people love hearing about what I think is best for them. And if you're looking at some, a 70-year-old person who's immunosuppressed and has a history of multiple skin cancers, yeah, your advice is going to be different than if it's a young, healthy person who gets moderate sun exposure. And so I don't really have a hard time telling people what I think is best for them, and I think they appreciate that. So I think we talked about last time, kind of deciding who's high risk, who's low risk, and what recommendations, to give them. But it's not something I think people appreciate it.
Well, now that we've talked about the fact that we want to be moderate with it, let's talk about the science of what is the good parts that come out of sun exposure. And, I think we already know that. I mean, obviously we have UVB phototherapy. So clearly there's some benefits to the
Yes.
ultraviolet light, like for, say, psoriasis or atopic derm or for pruritus. But what is the underpinning science there? Like, what are the good things that come out of photo-based approaches to the
Yeah,
skin?
yeah. I'm so happy you asked because I was really sad last time we talked the whole time and we never once even talked about photoimmunology, which is like my most favorite thing. So there's a lot of benefits for things like dangerous cancers like breast and colorectal cancer risk. There's benefits for cardiovascular disease, which are really, really profound. And I would highly recommend checking out Dr. Weller has a TED Talk. I think it's like 2014, it's pretty old now, about the benefits on the cardiovascular system and nitric oxide release and things like that. But my passion, my interest is really how the sun and specifically ultraviolet light influence the immune system. And that's why it's my most favorite treatment modality here at my clinic, which used to be predominantly phototherapy. And now I've kind of moved into functional dermatology. But phototherapy works on the skin, but it also works internally. So at the level of like the spleen and the lymph nodes and the bone marrow, you actually get it's not really immunosuppression. It's kind of like a modulation, like a dampening of the immune response. And so you see less inflammatory disease like eczema, and you see less autoimmune disease like multiple sclerosis, type 1 diabetes, inflammatory bowel disease, rheumatoid arthritis, all of these things that are caused by overactive immune systems. There's a latitude gradient for these, and there's a reason for that. And that's because the sun very naturally kind of subdues the immune system and increases something called regulatory cells. So there's B and T regulatory cells that are like the natural calming off switch. It's really quite lovely.
Katie, I appreciate you bringing this up. You know what's crazy, Hadar? So this was Richard Weller, and he's in the Department of Dermatology at the University of Edinburgh. And when you said, a long time ago, this was actually put forth, Hadar, do you remember?
I
That
know
was
what you're
actually
about
one
to
of the
say. I
controversial
know.
abstracts at the Edinburgh International Dermatology meeting in
Yep.
Edinburgh when you and I went there. That
Yeah,
was
no, I knew. Yeah, we're getting old, my friend. This is now
The
so
old
I
story
hat.
know. So when
changes.
it's like a long time ago, I'm like, oh my God, I remember when I was like a spry resident and we were running around, just trying to figure out like what we were going to go look at. And the crazy thing is, he talks about the fact that we use vitamin D as the indicator of the benefits of the sun,
Yes.
but it is just one of the indicators and it might be a proxy, but it's not the only mediator of the
Yes.
beneficial effects. And I think we make this mistake that we think just because we figured out one thing that the sun does good for us, that
Yes.
encompasses all the things that it does for us.
100%. And I think what really drives that point home is all of these. I mean, we have huge, huge, huge studies that have come out over the last few years of massive amounts of like vitamin D supplementation. And you would expect with all of these diseases associated with inadequate vitamin D that there would be benefit, but they really fail to show benefit for cardiovascular disease, all cause mortality, the things that you would expect vitamin D supplementation should do. But like you said, it's really a marker for something greater and bigger than just the vitamin D, which is sunlight.
Yeah, so simply saying supplement with vitamin D and you get the benefits of the sun is just not true. It's not accurate.
It's
It's
just
one of the
not
benefits.
true. Yeah.
So it's not the full picture. So that being said, we have all this conversation about how good sun can be for you. What about how to actually think about photo protection? Because that's another aspect of things that we wanted to cover
Yes.
that too. And so, what is our understanding of the roles of like the different, approaches to sun protection that isn't just focused on sunscreen? You're an integrative dermatologist, Katie. You do functional medicine. I'm sure a lot of people ask you about what is the inside out approach. How do
Yes.
you approach that?
Yeah, and I love love love, the idea of systemic photoprotection because what it does is it enables you to get the benefits of sunlight, but still get kind of maximum defense against, things like photoaging and skin cancers. And so there are really beautiful chemicals in our food, like phytochemicals and whatnot, that very naturally protect your skin from the sun. And so I'm excited to talk about it because there's so many.
Well, why don't you give us a taste? No pun intended here.
Oh,
Uh,
done. Well
because
Uh,
done. The dad joke. All right. Yay.
yeah,
so
check
a taste. So
check one for me. Yeah, but because I know you're going to speak at the Integrative Dermatology Symposium, so I don't want to give it all away, but I want to hear some of.
yeah, no spoilers.
No spoilers, but we love food here, so give us a taste.
Yes, yes. And so the way, because it can get so complex, especially if you like just PubMed search like phytochemical and photo protection, like it's like gonna blah everywhere. And so the way that makes sense to me to kind of break it down is you're really looking at kind of the micronutrients that are required for your antioxidant complexes and DNA repair, and making sure that you're getting all the micronutrients that you need to optimize those systems. Then your omega-3 kind of 6 balance, right, which we know is important for everything as far as how your body manages inflammation of any sort. And then there's the phytochemicals, which I keep talking about. So these are your flavonoids and your carotenoids and all the beautiful substances that are in your colorful fruits and vegetables, and then hopefully maybe in the animals that you eat if they are eating those beautiful vegetables themselves. So it gets deeper and deeper and deeper, but that's where I would kind of break it into the headers anyways.
Speaking about those animals, I mean, are you suggesting, because I know that there's some really nice carotenoids that come off of algae, and that's more of a marine kind of a source, like astaxanthin, for example.
Mhm.
Are you thinking about fish that eat those algae, or what is your thoughts on, or lobster, or what is?
I'm definitely not an expert and I have not read the research myself, but I've heard and it makes sense to me that any animal that you eat, whether it's a marine animal or if you're talking about like a cow, if that animal is being fed a bunch of GMO corn, it's going to be made up quite differently than if that animal is out foraging and selectively targeting the plants that, it knows it needs for its body. And so I think that that's just one of the problems in our food system right now is the quality of the meat that we're getting to.
Yeah,
But
you don't know what you're getting. Well, maybe we just stick to the supplements then if you really want the
yeah,
photo
I don't know that
protection.
much about it, but I feel
Yeah,
like
but
it
now,
makes
can
sense
you
to me.
talk about some of the
Yeah.
supplements that you specifically
Yes.
would talk to your patients about?
Yep. Yep. So the micronutrients are really pretty basic. A basic multivitamin is going to get you your manganese and your copper and zinc and whatnot. But the main one that stands out with the micronutrients is going to be B3 and specifically niacinamide. So, as you guys know, niacinamide has made its way into very traditional dermatology and, the JAD and these big, conventional dermatology papers and whatnot as being beneficial for people who are high risk skin cancer. So there was a big on track trial, I think it was 2015, where they showed that people who are high risk and take this niacinamide twice a day for a year had a reduction in both skin cancer development and precancerous spot called actinic keratosis development. And so I think it's really pretty profound for just having a single supplement to make a difference and find it statistically significant, because that's, in the world of like plant medicine and whatnot, you hardly have one thing in isolation. But even alone, the niacinamide was helpful because what it does is it there's this oxidative stress and kind of energy crisis that happens in the cell. And what the niacinamide does is kind of protect against that energy crisis and enables the DNA to repair appropriately. So that one is specifically one that we definitely would recommend for high risk skin cancer patients.
I want to know how you use it practically in clinic. So, is it
Yeah.
supplement? Is there a food source that can be useful in this particular scenario?
So for people who are not particularly high risk, I don't always add it. So certainly if somebody's had one or two skin cancers or who are just, walking around really fair, having a lot of skin cancer or sun exposure history, and you're kind of like a ticking time bomb, I do use it for that. And it would be 500 milligrams twice a day. There are really, really nice supplement blends that also contain it. And so I use one called Enerva. It's called Dermal Radiance. And they have, I think it's like 250 milligrams of the niacinamide. So it's not that huge, big whopping dose for high risk people, but it's a blend, right? So it's got the niacinamide in there. It's got a lot of the plant phytochemicals in addition to the minerals. And so there's really nice blends that I'll do for people who are lower risk, but maybe get a lot of sun like myself. So that's how I use the niacinamide, either in a lighter blend or, packing the punch with the 500 twice a day.
Can I make a quick comment on niacinamide? So they did a recent one on like super high risk skin, like transplant recipients, and they didn't see much of a difference for niacinamide in that group. But they just did a big meta-analysis looking at 29 studies, and they found that the rate ratio was zero point 0.5. So it's like almost a 50% reduction by just being on. And the dose that they looked at was overall, they said topical doesn't work as well as taking it orally, and that your dose should be at about 500 milligrams BID. But even at a lower dose, they found benefit in some of the studies. So it's pretty interesting. So maybe if they're super high risk transplant patients, maybe you need to also be sure that you're doing other things. But I think in the
Right.
general population, it did reduce the risk, which is pretty impressive. 29 studies too.
Yeah. Yeah. Because you have to track people for a long time to get enough skin cancers to come out of the woodwork, to be able to see that difference. And so it's pretty impressive. The other one that does have some pilot studies as far as like reducing skin cancer, at least the non-melanoma skin cancer in high-risk transplant patients, are the omega-3s, which was really, really interesting to me. I wasn't expecting that when I was doing
That's
some
pretty
of the
interesting.
research. Really cool, right? And because we know that these long chain omega-3s kind of intercalate themselves into the membranes of the cell. And then when you get those inflammatory stimuli like ultraviolet radiation, instead of producing these really, really highly inflammatory prostaglandins, they make ones that are a little less inflammatory. And so it's kind of like a blunting of the inflammatory response from UV. And then there also some thought that maybe it's kind of absorbing as like an oxidizable buffer itself too. So there are some pilot human studies where it shows, it's not statistically significant yet because it's just a little pilot, but it's trending in the right direction. And there's robust, like a ton of animal, mouse models showing that it reduces the development of skin cancer after ultraviolet exposure. And then, of course, like most of the studies, there's these reports showing an increase in the minimal erythemal dose with its use. So I think it's coming on up as far as something to be watching. So, and that was 3 grams a day, I think, for the omegas was what they were looking at. So kind of a bigger dose, but not unreasonable by any stretch.
Yes, and we know the benefits of omega-3 fatty acids for heart disease, et cetera. So I think it's a wonderful kind of addition to know, okay, I'm also
Yeah.
doing something to protect from the sun. And so I think you mentioned these supplements. Is there any other behavioral tips that you give your patients to go along with that? Is there any particular diet in general that's favored or any other tips that go with
Yes.
that?
Yes. And so the last category is, like I was saying, are these kind of phenolic polyphenols of plants. And so color is king. So like red, orange, yellow, your kind of deep greens and whatnot. These are going to be indicative of high polyphenol content or the non-phenolic things like carotenoids. And so you can take supplements if you want, I suppose, with these polyphenols, but it's really better just to eat it. So every meal it should be colorful because that's how you're getting these chemicals, these compounds. The carotenoids we were talking about a little bit before, clear increase in minimal erythemal dose, meaning your body can tolerate more light before it burns, even with something as small as like 1.5 tablespoons of tomato paste, I think it was, that they used. So carotenoids can act like a sunscreen up to SPF of about 4 just by eating those. And it's not like whopping doses. This is something that's very attainable. And then the other ones that really stand out just to mention in the studies where they're showing at least an increase in that burn dose or a decrease in skin cancer in mice would be pomegranate, green tea, the genistein, that isoflavone. And then we would be remiss to exclude Polypodium leukotomos, which is another big favorite. I don't know if it's really good marketing or how it came along, but it works. It works really, really well. Like I use these supplements, like I was saying, in my phototherapy clinic, and when people just can't quite tolerate the sun, or the light, or if they have vitiligo and they don't have protection from melanin, like they really, really work. And Polypodium leukotomos is one that just really works, and it's got robust science behind it. So I like that.
Can we talk about mechanism of action too, just for a little bit? So some of these
Yeah.
supplements probably add antioxidant power directly.
Mm-hmm.
I'm sure they do. But some of them may actually be anti-inflammatory. And do you think that's how they bring the SPF into a different category, by just taking it longer for you to get red?
Yeah, and that's the beauty of the plants, right? Is like if you're looking up the mechanism of action for niacinamide, it's like this is what it is. But when you're looking at something as complex as Polypodium leukotomos with all these phenolic compounds, it's hitting like everywhere in that cascade of photocarcinogenesis, where you're going from goodness to badness, right? So it's reducing oxidative stress, it's reducing inflammation, it's preventing that immunosuppression, which can occur with ultraviolet light. It improves the ability of the DNA repair. And so it's like, there's 100 studies that all talk about, different parts of that cascade that it improves. And I think that just speaks to kind of Mother Nature and the complexity of these plants.
No, that's wonderful. And I think everything you're saying makes a lot of sense to me when I think, for example, about Mediterranean diet that is rich in omega-3 and all these colorful vegetables, for example. So to me, that makes a lot of sense and jives well with everything we know. We talked more about protection from burning, from erythema. What about aging? I think a lot of people are very curious to hear about that.
Yes. And there is definitely a lot of studies on aging too. And aging is, we look mostly, inflammation is of course important too, but that oxidative stress is really where we're looking for the photoaging effects. And so UVA, although UVB will also cause oxidative stress, UVA is really kind of the big hitter. It's present when you wake up. It's present when you go to bed. It comes through your windows. UVA is just kind of always there, and it's always causing oxidative stress in the skin. And then that oxidative stress causes not just DNA damage, but it causes damage to all of the cellular structures, the matrix of the skin that gives you youth, right? Your collagen and your elastin and all of those things. And so it's the same, like if you're wanting to protect yourself from skin cancer, it's the same effect. You're also going to have anti-aging effects because you're blunting that stress pathway and the inflammation that causes that. So there is a lot that I'm not as familiar with as far as topicals as well. So I don't know like the cosmeceutical stuff quite as well, but I know that they're doing a lot of work with these same kind of compounds, whether you're talking about antioxidants or anti-inflammatory from a topical perspective too. So I just don't know it quite as
That'd be
well.
a whole nother podcast we'll get you
Yeah.
on for that one.
Yes, for sure. So
Oh
Yeah,
my God.
absolutely. And from a philosophical point of view, a little bit, just taking the 30,000 feet view here, it does make sense that we have evolved beautifully to coexist with the sun, right? And
Is
as
that
long
another
as
pun? 30,000 feet, Hadar? I like it.
yeah, exactly. And I do like this concept because, with our modern lifestyle, we add a lot of insults to our body. And so trying to fortify our natural ability to kind of jive with the sun and sunlight really makes a lot of sense. And Katie, you do such a great job of bringing it together for me. Every time I listen to you, it makes a lot of sense to me. And guess what, everyone? Even if you want to hear just more from Katie, she will be speaking at the Integrative Dermatology Symposium. Where is that, Roger, going to be? Where? Remind me.
It's going to be in sunny, hopefully, Reno, Nevada. And it's
There
going to be
you
from
go.
October 27th through the 29th. And our theme this time, it totally fits. It's going to be around nutrition. Doesn't mean every lecture lecture is going to be about nutrition. But that is definitely going to be the food for thought that's going to sink in through the entire conference. And of course, this is right in that wheelhouse.
Exactly. And so everybody come to Reno, get some good food, get some healthy dose of sun, and a lot of learning with Katie and other great speakers. So Katie, pleasure to have you again on the podcast and looking forward to hearing you speak in Reno.
Thank you so much. I had a lot of fun.
Thank you so much for supporting us through the last several seasons. We love receiving your questions on social media. And now you can call them in as well.
Yeah, exactly. So if you're a licensed medical practitioner, call us at 424-309-8757 and leave a detailed recording with your name, location, clinical question, and it may just be chosen to be answered live on the next podcast.
We look forward to your submissions. And as always, stay curious.